Hello and welcome to the second video of this series related to the curriculum development in health professional education. The main aim of this video is to support postgraduate health professional educations, master students, PhD students with the important knowledge and skills related to curriculum development in health professional education. My name is Mohamed Hassan Taha. I am a medical educationist with the passion to advance health profession education to improve the population health. Today's video will be about learning environment in health profession education. So to understand the concept of learning environment, let us understand the learner ecology, and it's typical at ecology or environment in which we have the settings which shape the environment, including the workplace. We have the organizations, rules, regulations, learning experience, and learning background. As you can see here in the screen, the curriculum design and structure, the instruction, the way we are delivering the curriculum, the material, the written handouts, the assessment format, the role and task of the teachers, the culture, the evaluation, overall evaluation of the program. So all these are considered as numerous aspects interact and contribute to the learning. The learning is not about the curriculum that we have written, we have developed. And as you can see here, we have the students here, and we have here what we learn, what to learn at the content, and how to learn at the methods. And here the outcomes. This will shape the outcomes of the curriculum. And from the design perspective, the outcome should lead this. And we have also the assessment. This all together called the environment. And let us define the learning environment. What do we mean by learning environment? Learning environment is composed of the three components, including the physical environment, as well as the emotional and the intellectual climate, and contribute significantly to the well-being of our students. And the term include also the learning resources, the technology, the mean of teaching, the mode of learning, and the connection to the societal and global context. And it's very important for us as educators to have a good understanding about this learning environment, because it shapes the way that we learn, our students learn. And several researches have shown that an engaged learning environment increases student attention and focus, and promote meaningful learning experience, encouraging higher level of student performance and motivate students to practice higher level of critical thinking. And so for this reason, it's very important to work for a supportive learning environment. So learning environment, it's not just simple terms or keywords that we can highlight in these sessions. It's learning environment. It's about how students are taught and education strategies adopted, what they are taught, how they are assessed, the type of clinical experience offered, the book and the resources available online or library, the value expressed by their teachers, and the value that being demonstrated by their teachers, the hidden curriculum. The physical factors such as the lecture, theaters, seatings, heatings, level of noise, and so on. So all these contribute to the learning environment. So for this reason, we'll find many inventories now has been developed and evolved in order to measure the learning environment. And you will find here a list of inventories. You will find DREEM, PHEEM, John Hopkins environment, and many scales, even at different places. For example, a team for like in anesthesia, STEAM for surgical, and so on. So you can take a screenshot of these slides to see how many inventories. Also here, other many inventories that you can see. It is very important to conduct research related to studying the learning environment, because studying learning environment will help us to answer critical questions such as, maybe in our philosophy as medical school or health sciences school, we say that we are fostering collaborative learning approach, student-centered approach. But would like to know the following by using measure or measurement for the learning environment. Are we promoting collaboration or competition between the students? Is or are the students encouraged to ask questions and think creatively, or they are being passive? Is the curriculum meeting the needs of the learners or meet our learner as educators? Does the curriculum challenge and stretch students or require only minimum competencies, such as assessing the superficial learning? If the environment is a trusting one, where the teacher is supportive and tolerant of mistakes, or it is a teacher viewed and with the suspicions as enemy of the students? These very important and critical questions. And by assessing the learning environment, we can have like objective measure that, and we can have a real understanding of our curriculum in action rather than only the blank curriculum. So the aspect of the learning environment, in a summary, is collaborative or competitive orientations. Is it student-centered or teacher-centered? Is it supportive or based on the punishment orientation? Is it community or hospital orientation? Is it research or teacher teaching orientation? These very important central goals of our educational system that we can answer by assessing the environment, because you can see that some medical schools, they say that we are community-based education approach, while most of the training take place in the hospital. So it's very important by measuring the environment, we'll see are we in alignment with our mission or no. And if we don't measure the learning environment accurately and frequently, we may end up with these problems. So we have some sort of student stress, anxiety, academic performance may be affected, achievement of the learning outcomes will not take place, and this definitely will lead to problem with the future healthcare providers, because there are many concepts that related to the professionalism and issues that within the hidden curriculum could be measured with the learning environment. So our role is to support our students, and to support our students from the design of the curriculum, the teaching quality, the having supportive mechanism with our quality as educators, and this will lead to a motivation of the students. These very important things that need to be considered, and definitely will enhance and will be related to learning. So it is very important when measuring the learning environment to look at the measurement approach. Are we measuring the actual or the ideal approach? So we need to measure both the actual and the ideal. And the actual is typically what is perceived by the students, like sending them a questionnaire, asking them about what they perceive about the environment. And it's about how students report what they actually experience in the learning environment. While for the ideal or for the preferred learning environment, when asking the same students to rate how the environment should be ideally. And it's very important to measure both and to compare both the actual and ideal. And comparing the actual and ideal scores reveal gaps between the experience and expectations. So if we find large gap between experience and expectations, this highlight immediate change, corrective change measure. So for example, if many students prefer small classes than experience, this signals need to shift toward small group learning, and so on. In a summary, a positive educational environment, supportive teacher, good resources, inclusive culture, post learning outcomes and satisfaction. On the other hand, a poor climate harm students' well-being and achievement. So the learning environment can be measured through a validated tool, but when we say validated tool, validations in your context is very important, because this tool has been developed in
specific context. So we need to do pre-testing and validation for your own context. And the common tools that use like DREEM, PHEEM, John Hopkins, learning environment measurements, and so on. This tool is quantitative. We need to mix between the quantitative and qualitative approach in measuring the learning environment. Also, stakeholder input is very important. This will help us to identify the gaps between the aspiration and between the reality, between the actual and between the real learning environment. So systemic use of these surveys support continuous improvement and helps profession education schools functioning as a learning environment. Thank you so much for watching this video, and now we will move to the third video of this series. See you there.